work in anti-racism and healthcare. So I've worked with SETI for a number of years now on such issues.
So we're talking about artificial intelligence. So it refers to computer systems or software designed to perform tasks that usually require human intelligence.
We all, as you've heard me say many times, have agency to act. CAN did not wait for the agencies to change. They got on with it, and I salute them for it.
Look, thank you for allowing me to be part of this conversation. Look, let me also start by saying I will not experience the realities and the experiences many of you have day to day, but I am here as your ally and as your partner to work alongside, to understand the changes that we need to make together.
And how those two forces, the structural racism and the interpersonal racism, play in and play out with regards to our institutions and institutional racism, and how that plays out in the policies and the processes that we often experience on a day-to-day basis.
For those of you who don't know me, I'm SETI Frederick, and I co-chair Inspire. I also chair NHS Kent and Medway and lots of other things as well. And one of the things that I've been involved in for about 4 years now is what I've described as my passion project, which is Conciliaris Digital System.
Could you tell us again, what was your talk? What was the topic of your talk?
The topic of my talk was about the value of community inputs in terms of what that means with patient safety. So I approached it again using my well-loved R&B focus and looked at it from 3 perspectives. So how patients can keep safe by themselves, what we can do as healthcare professionals, whether you're in health and social care, what we can do to keep our patients and service users safe, and then what we can do as a community to keep each other safe.
And so my message would be to all of us, let's build on the success, because there have been successes. Let's build on those by simply embracing our own agency to act and continue to expand our spheres of influence rather than being worn down by our circles of concern.
I've been so inspired coming here, hearing from amazing speakers, and also connecting with so many people doing amazing work.
It's been a really great day so far. There's so much energy in the room. It's really, really great to see so much enthusiasm, energy and support for all the speakers and everybody that's come here. So yeah, enjoying it and looking forward to the afternoon.
The truth is, we must remain vigilant. We cannot afford for black health to be pushed aside in the wider NHS reform. That means keeping up with the news, lobbying our MPs and contributing to the movement.
People from all walks of life, in different phases of their careers, around the importance of focusing on black health and to share some of the great work which is being done.
Really, really important for us to continue this work that we've been doing, and maybe next year, who knows, it's Haringey and Enfield this year, maybe next year there will be 4 names, 4 boroughs up there. So
after I started doing some voluntary work with Khan, I thought, with regards to change, if nothing changes, nothing changes. So, and that's why I got involved with my Royal College, because we had very little representation.
My own passion is for widening access, particularly from underrepresented groups and communities, both to higher education and to other opportunities in life. And I'll talk a little bit about our Vice Chancellor Development Programme in a few moments.
In Abuja, where the nurses, doctors, and actually the gentleman in the middle is my own son, who goes with me He's a transplant trainee, vascular trainee at St. Mary's Hospital, so he goes with me to help me with the transplants. Actually, as a matter of fact, I came back on Monday from Nigeria. I was there for 2 days where I performed 7 kidney transplants in 2 days.
There are some immediate steps that we know the NHS needs to take to improve care rapidly, but the plan's going to focus on some of that longer term activity so that we can reform things to deliver better care for future generations.
People of black African origin are up to 3 times more likely than white people to develop type 2 diabetes. High blood pressure and obesity are also a huge problem within our community.
Good to know if you feel that today has been impactful for you. How's it been? Good.
I just want to say thank you to all of the speakers today. They've been absolutely incredible,